Sepsis mortality rate in the United States. The sepsis remains one of the most pressing health issues in the United States, affecting millions of people each year. The mortality rate of sepsis is alarming, especially considering the number of lives it affects and the diversity of its manifestations. Sepsis is often described as an overwhelming and life-threatening response of the body to an infection, in which the immune system initiates a series of devastating events. These events lead to inflammation, blood clotting, and damage to vital organs. If left untreated, sepsis can quickly progress to septic shock, which has an even higher mortality rate. In the United States alone, an estimated 1.7 million people are affected by sepsis each year. Of this alarming number, approximately 350,000 die from complications of sepsis. In fact, sepsis is gender-neutral, affecting people of all ages, genders, and socioeconomic backgrounds. However, people with weakened immune systems, those with chronic medical conditions, and the elderly are particularly susceptible. Sepsis varies in severity, and the associated mortality rate reflects this difference. If detected early and treated effectively, the average mortality rate for sepsis is approximately 20 to 30%. While this rate is high, it is relatively low compared to more severe cases, highlighting the importance of early diagnosis. As the infection progresses, patients may develop severe sepsis and organ function begins to malfunction. At this stage, the mortality rate rises to around 40%. The longer a patient goes without proper treatment, the higher the likelihood of death as the body's systems begin to fail under the stress of the infection and immune response. Septic shock is the most severe form of sepsis and has a mortality rate of 40 to 60%. The condition is characterized by extremely low blood pressure that does not improve after fluid resuscitation, leading to poor organ perfusion and an increased likelihood of multi-organ failure. Once a patient reaches this stage, their chances of survival are greatly reduced despite aggressive medical interventions such as vasopressors and intensive care. Sepsis not only leads to high mortality rates, it also places a significant economic burden on the healthcare system. In the United States, sepsis is the most expensive illness to treat in hospitals, costing more than $62 billion annually. Sepsis-related hospitalizations often involve prolonged stays in intensive care units, where the use of advanced treatments such as mechanical ventilation, renal replacement therapy, and vasopressors is common. Sepsis survivors often experience long-term health consequences, often referred to as post-sepsis syndrome. These consequences can include cognitive impairment, physical weakness, and increased risk of future infections. The management of these long-term complications further increases healthcare costs and highlights the profound and lasting impact of sepsis on individuals and society. Causes of sepsis. Understanding the underlying causes of sepsis is critical to developing preventive measures and treatment strategies. Sepsis occurs when the body's response to an infection goes out of control. While it is vital to fight infection, the body sometimes overreacts, causing widespread inflammation that damages tissues and organs. The question remains, what triggers this dangerous response, and why do some infections lead to sepsis while others do not? The most common cause of sepsis is an infection, which can originate anywhere in the body. While sepsis can be triggered by various types of infections, bacterial infections are the most common culprits. The bacteria that cause sepsis can vary, depending on the location and type of infection. Here are some common types of infections that can cause sepsis. Respiratory tract infections. Pneumonia is one of the leading causes of sepsis, especially in older adults and those with compromised immune systems. These cases often involve bacterial pathogens, such as Streptococcus pneumoniae, Staphylococcus aureus, and Legionella. Viral respiratory infections, including COVID-19 and influenza, have also been shown to cause sepsis, especially in patients with underlying health conditions or weakened immune systems. Urinary tract infections, especially when combined with kidney involvement, pyelonephritis, can lead to sepsis. UTIs are a common precursor to sepsis in older adults and patients with catheters or chronic kidney disease. Escherichia coli is often the type of bacteria that causes these infections. Abdominal infections, such as appendicitis, diverticulitis, or intestinal perforation, can lead to widespread infection and sepsis. These infections often involve a variety of bacteria, including E. coli, Klebsiella, and Bacteroides. Skin and soft tissue infections, such as cellulitis and necrotizing fasciitis, colloquially known as flesh-eating disease, can progress to sepsis, especially in individuals with weakened immune systems. Burns, surgical wounds, and even minor skin injuries can provide entry points for bacteria such as Staphylococcus aureus and Streptococcus. Bloodstream infections. Bacteria that enter the bloodstream directly are called bacteremia and can cause rapid and severe sepsis. Catheters, IV lines, or other medical devices used in hospitals, especially in intensive care units, can cause bloodstream infections. Gastrointestinal infections, including those caused by Clostridium difficile, can lead to sepsis, especially in patients who have recently undergone surgery or antibiotic treatment, because these infections disrupt normal intestinal flora and promote bacterial overgrowth. Blood test indicators for sepsis. One of the key ways to identify sepsis is by analyzing various indicators in a patient's blood. These indicators help healthcare professionals assess the presence and severity of an infection, as well as the body's inflammatory response. There are several key indicators that are often monitored in blood tests to diagnose or confirm sepsis, and understanding these indicators is critical for both clinicians and patients. White blood cell count is one of the most commonly used indicators for diagnosing infection and sepsis. White blood cells are part of the immune system and play a vital role in protecting the body from infection. In the case of sepsis, the body's immune response causes a dramatic increase in white blood cells, but in some cases, especially in advanced sepsis or septic shock, white blood cell counts can be abnormally low, reflecting a severely weakened immune system. Normal range: 4,000 to 11,000 cells per microliter of blood. A white blood cell count of more than 12,000 cells per microliter of blood may indicate an acute infection and the potential for sepsis to develop. Platelet count. Sepsis can lead to a decrease in platelets, thrombocytopenia. Normal range: 150,000 to 450,000 platelets per microliter. A low platelet count, less than 100,000, can be a sign of sepsis. C-reactive protein, CRP, is a substance produced by the liver in response to inflammation. CRP levels increase when there is inflammation in the body, such as when the immune system is fighting an infection. As sepsis progresses, CRP levels in the blood tend to increase, making it a valuable marker for detecting and monitoring sepsis. Normal range: less than 10 mg per liter. Increased CRP levels in sepsis. During severe infection or sepsis, CRP levels may rise to 100 mg per liter or higher.